My name's Dr. Blake Chandler. I'm originally from Henry County. I graduated from Henry County High School. Went to college at University of Tennessee, Knoxville, and then did medical school in East Tennessee, and then went to Memphis and did my residency at Campbell Clinic in Memphis, and then came home. My family's from here. Me and my brother, my mom and dad, we all grew up in Puryear, and she was a school teacher at Puryear for 38 years, so I'm a Henry Countian, and I guess you could say a Tennessean my whole entire life. So I practice general orthopedic surgery, and my practice kind of focuses a lot more on total joint replacement. I do a lot of total knee replacements, total hip replacements, and total shoulder replacements. I also do a lot of arthroscopic work, rotator cuff repairs and knee arthroscopic surgeries. And I do hand surgery with carpal tunnel releases and trigger finger releases. Being here in Henry County for 14 years now, I've gotten to do a lot of industrial injuries too, so I take care of a lot of the workers' compensation injuries for people in surrounding counties. With my satellite office in Union City, I get to go there and see some of their injuries too. So I do most everything except for I don't do a lot of spine procedures, and I don't do pediatric procedures. Having done my residency at Campbell Clinic in Memphis, I'm pretty conservative with my philosophy on orthopedic surgery. I try the conservative approach, if at all possible, to see if we can get the patients better and more mobile and back to their pre-injury function without the need for surgery, if at all possible. And then when it comes time for surgery, my philosophy is I'm very results oriented. I want the best results possible, so I try to stay up to date on the newest procedures, which is why I do the anterior total hip replacement and why I do minimal incision, patient-specific total knee replacements. And I try to keep up with the latest on pain management for my total joint patients. So my philosophy is conservative if at all possible, but if you have to do surgery, you need to make sure you're doing the most modern things available. I'm an avid hunter and fisherman. I love to hunt and fish, and I'm a huge Tennessee Volunteer fan, so I have season tickets and I go to every Tennessee game that I possibly can. But if I'm not working or I'm not with my family, I like to be hunting and fishing if at all possible. I think probably the most important piece of advice I could give when you're selecting a surgeon is just to make sure that that surgeon is well versed and has a lot of experience in that particular problem. For instance, my anterior total hip replacements, I've done over 100 of those, and there's definitely a learning curve with those. So you want to get a physician that has done plenty of that particular procedure and feels comfortable doing that before you have surgery done.